So if you look at like the first half of our menstrual cycle, which is the follicular phase, you've got an increase in estrogen, which promotes neural connections in the brain, makes you feel a little bit smarter, it's easier to concentrate and focus, your memory is a little bit faster. You've also got an increase in testosterone, which increases aggression. You could also think of like energy and motivation, goal-directed behavior, increases libido and that feeling of like sexual connectedness. And then you have that FSH-LH pulse causing ovulation. That triggers the progesterone to start rising by the corpus luteum. The progesterone can kind of act to counteract a lot of what the estrogen was doing. All that increased neural connections, the progesterone quiets that. So we might feel a little bit more tired. We might feel like our thoughts are coming a little bit more slowly. Some people feel it quite strongly, like they're in kind of a fog or a haze. And then if that egg is not fertilized, then you have this drop in all of those hormones. The estrogen, the testosterone, the progesterone kind of rapidly plummet. Some women really, all of these things could be happening and they might not really be noticing them. They don't feel the shifts in these hormones cognitively or emotionally. But some women really can notice. They notice the increase in estrogen and those increased neural connections and energy, and they notice the quieting that can happen with the progesterone. And then when that progesterone pulls away, you can almost go into like a state of withdrawal, right? Like withdrawing from alcohol or withdrawing from a benzodiazepine, and it causes those feelings of irritability, depression, or emotional reactivity.